Hello, welcome. Dr. Erin here again. So today we are going to talk about folic acid and how it's important for you that is pregnant, that is planning to get pregnant, or is pregnant. So folic acid, many people do not know. Actually, I noticed that very many of us ladies do not know that if we are planning or we are pregnant are supposed to be taking folic acid. And most importantly, for those that are trying and planning, for the best way to achieve pregnancy is to start taking your folic acid at least 3 months prior. Because 3 months prior, it helps you. This is when you hope to create a foundation in your body to be efficient enough, for the baby to have a proper foundation for growth in your body when time comes. So the reason why do we take folic during pregnancy? It is because it helps with growth of vital organs in the baby, especially the spine, the brain, because by the time you're finding out that your pregnancy is around four weeks to a month, that is when you have missed your period. And at this point in time is when the foundation of the brain and the spine are being formed. So this is where your body needs to be very adequate with the folic acid. Otherwise, we're going to have issues of defects of like spina bifida, cleft palate, cleft lip, hydrocephalus, anencephalus, heart defect, because we're not having adequate folic into our bodies. So as a person that is trying to get pregnant or that has just found out they are pregnant or that is pregnant, you need folic acid so much because it helps in growth of vital organs like the brain and spine, like I mentioned earlier. It helps in formation of cells, formation of DNA. So the faster you do it in pregnancy, or the earlier you do it in pregnancy, the better for you and for a baby and for a healthy child in general. So sometimes the amount the deficiency of folic in our bodies is sometimes diet related. Sometimes supplements we take while pregnant do not have enough quantity of folic in them. I won't mention, but if you need to know, you can ask in the comments and I'll respond to you. So don't have enough folic in them, so you need to be keen. Sometimes they'll ask you to take supplements plus the folic. Sometimes you'll take only the supplements, but always ask your health worker, that's your trusted health worker, to explain to you